Our first speaker this morning is Dr. Gary Gottlieb, the President and CEO of Partners Healthcare, and a longtime supporter of community health centers and the important role they play in our healthcare system. Partners Healthcare has a long history of investing in the state's network of community health centers. Dr. Gottlieb is here today to talk about this new grant initiative that will bring important resources to community health centers at a time of great transformation in the healthcare system. Dr. Gottlieb.
Good morning, everyone. Good morning. It is a pleasure to be here this morning. Thank you, Bob, and thank you for your remarkable leadership of this truly important resource in our community, this leader in healthcare delivery here in Massachusetts, as well as a national leader, as you point out, in the training of young family practitioners and in creating a paradigm for improved care overall. It's so great to be here with all of you in Lawrence as we announce and celebrate the very first round of grants delivered to community health centers across the state as part of our newly formed Partnership for Community Health. The partnership was created by Partners Healthcare and Neighborhood Health Plan as part of our new relationship, and it is just a tremendously exciting venture. The program offers community health centers across Massachusetts a new level of support at a moment of great transformation in healthcare. This is a moment in which things are changing at light speed in regard to the way that we expect to be paid, in how it is that healthcare is to be organized, and the burden on us to be accountable to our communities, to the population, in providing the best possible care and do it in a way that's effective and efficient. And community health centers are at the core of our ability to be able to do that. That's what kind of makes our new partnership with Neighborhood Health Plan so exciting. We share a common vision and history and recognition that community health centers are in fact the answer, and will provide the opportunity for us to be able to create new opportunities and paradigms for design and new approaches to provide the very best possible care to everyone who needs it in the Commonwealth, and to do it in a way that's effective, efficient, create cost savings and innovation in a constant way. This kind of transformation will absolutely require real investment. It will require investment in programs that remove barriers to access and improve health equity, removing the disparities that Bob described to us a few moments ago. And it will require investment in new ways to better coordinate our patients' care. And as Bob described in a visionary and prescient way that this health center started 14 years ago, it will require significant investment in health technology and health information overall, in people who can use that technology better to be able to service our community and to ensure that the way that we are able to deliver care is supported by an administrative infrastructure and a set of ideas that is able to translate the care that we're doing into appropriate payment for that care and to appropriate investments in improvement in that care and its access in a continuous way. So how appropriate is it that we make this first announcement here in Lawrence, a community that has led and experienced decades of transformation in its industries, in its people, and its skills overall. From the industries that have breathed life into Lawrence over generations to the diverse populations that have been cared for and served, we can look to the Greater Lawrence Family Center as a leader and crucial advocate for healthcare in this community overall. With investments, as we said, in electronic medical records, a new emphasis on delivering care through patient-centered medical homes and focusing on those at greatest risk and highest need, and in a paradigm that embraces training and the delivery and a pipeline of the leaders of the future of healthcare, this couldn't be a better place for the staff and leadership to put their resources together in a way that's more productive for our communities. And we know that other health centers across the state are taking great steps to lead with similar improvements and with innovations. So we're here today to announce that the first round of grants, totaling $4.25 million, will support pioneering efforts at every single health center in the state. We're pleased to announce that the Greater Lawrence Family Center will receive $150,000 to support the work here. Over the next decade and a half, the Partnership Community Health will provide up to $90 million to support centers across the state. It's a journey that Massachusetts will keep focusing on to help us to keep ahead of the rest of the country, to be able to set a pathway to provide the best care to those who need us the most, and to provide a set of innovations that will allow us to facilitate that. Partners Healthcare, Neighborhood Health Plan, and the League of Community Health Centers will be there on this journey, and together we can tackle the tough healthcare challenges that lie ahead. And we do this with a keen focus on providing the care, on improving the care that we provide to our patients and to all of the communities that we serve. Thank you very much.